Neuro definitions and assessments. Phineas Gage, from 1823 to 1860, is one of the earliest documented cases of severe brain injury. Gage is the index case of an individual who suffered major personality changes after brain trauma. The nervous system is a very complex system in the body. It has many parts. The nervous system is divided into two main systems, the central nervous system and the peripheral nervous system. The spinal cord and the brain make up the central nervous system. Its main job is to get information from the body and send out instructions. The peripheral nervous system is made up of all the nerves and the wiring. This system sends the messages from the brain to the rest of the body. A neuron is a nerve cell that is basic building block of the nervous system. These highly specialized nerve cells are responsible for communicating information in both chemical and electrical forms. Neurons have a membrane that is designed to send information to other cells. The axons and the dendrites are specialized structures designed to transmit and receive information. The connection between the cells are known as synapses, and neurons release chemicals known as neurotransmitters into these synapses to communicate with other neurons. Sensory neurons carry information from the sensory receptor cells throughout the body to the brain. Motor neurons transmit information from the brain to the muscles of the body. Neurons and other body cells both contain a nucleus that holds genetic information. Neurons and other body cells are surrounded by a membrane that protects the cell. Differences that make neurons unique. Unlike other body cells, neurons stop reproducing shortly after birth. Because of this, some parts of the brain have more neurons at birth than later in life because neurons die but are not replaced. While neurons do not reproduce, research has shown that new connections between neurons form throughout life. More than 100 years ago, it was discovered that if blue dye was injected into the bloodstream of an animal, that tissues of the whole body except the brain and spinal cord would turn blue. To explain this, scientists thought that a blood-brain barrier which prevents materials from the blood from entering the brain existed. The blood-brain barrier is semi-permeable, that is, it allows some material to cross but prevents others from crossing. In most parts of the body, the smallest blood vessels, called capillaries, are lined with endothelial cells. Endothelial tissue has small spaces between each individual cell so substances can move readily between the inside and the outside of the vessel. There are three membrane layers known as meninges. The meninges are the protective covering of the brain and spinal cord. This is the origin of pain sensation, which is why meningitis hurts so much. CSF is clear and colorless and cushions the brain and spinal cord. The dura mater, which is Latin for tough mother, is a tough and fibrous and lines the skull and spinal cord. Beneath the dura mater is the arachnoid. The arachnoid villi stick into the sinuses and are part of the arachnoid layer. They allow for reabsorption of CSF about 500 mL a day. CSF is absorbed in the choroid plexus of the third and fourth ventricle. This is important because subarachnoid hemorrhage or meningitis, which has debris and blood, can clog the sinuses and the patient can develop a communicating hydrocephalus because the arachnoid villi can no longer absorb the CSF. An example of a non-communicating hydrocephalus would be tumors. The thinner pia mater, in Latin known as tender mother, is a transparent layer that covers the brain. Extraocular movements are checked in awake patients only. So if a patient is in a coma, you cannot check EOMs, you are checking doll's eyes. EOMs are the 6 cardinal directions of gaze used to test the function of the eye muscles together with the nerves that supply them. The number indicates the cranial nerve being tested by the particular eye movement. One way to remember it is 4-eyed cross-eyed is cranial nerve 4. Cranial nerve 6 is out to the side. Then everything else is cranial nerve 3. Oculovestibular reflex. This shows an intact brainstem. Ice water caloric test is another name for this, and it is very powerful in eliciting eye movements. The patient must have an intact tympanic membrane and would indicate cerebellar or brainstem lesion. An intact tympanic membrane is essential in order for the test to be accurate. The head of the bed is elevated to about 30 degrees. The physician slowly injects ice water until nystagmus or eye deviation occurs, or at least 200 mL of ice water has been used. If in an unconscious patient, the eyes move slowly toward the irrigated ear and will remain there for 2 to 3 minutes. This is used for brain death criteria because it is one of the tests done. If there is no response, then they'll check other reflexes to determine if a patient is brain dead. Doll's eyes. This shows an intact pontine and midbrain. Ocular cephalic reflex is often called doll's eyes and is measured in unconscious patients only and is normally recorded as present or absent. The head would be turned side to side, and the normal response is for the eyes to go to the opposite side, and that would be doll's eyes present. Abnormal responses are recorded, doll's eyes absent. If the eyes move in the same direction as the head is turned and go no further than midline, this is abnormal. You would never test if there's a question about cervical or vertebral injuries. The Glasgow is a general measure of brain function. It is intended to rapidly communicate the patient's level of consciousness. So you're testing how well the brain is working both at cognition and motor function. That is to say, how well is a patient able to process information and then move their arm, their hand, or to obey command. This is also referred to as a Glasgow Coma Scale, and it operates on a scale of 3 to 15, in which progressively higher scores indicate higher levels of consciousness. For example, while a patient is profoundly unconscious would receive a 3 according to the Glasgow Coma Scale, a conscious healthy adults would be rated at 15. If the patient is alert or awake enough to answer questions, you'll also assess mentation. Determine if they're oriented to person, place, and time by asking questions like what is your name? Where are you? Pupils are another important component of the neuro exam. Assessing them is especially important in a patient with impaired level of consciousness. Like a change in level of consciousness, a change in pupil size, shape, or reactivity can indicate increasing intracranial pressure from mass or fluid. In order to assess long-term memory, you could ask like, how did you meet your spouse? A short-term memory would be, what did you have for breakfast? Obeying commands is definitely what you want for the patient to do, but localizing to pain is an organized attempt to localize and remove painful stimuli. Withdrawing to pain is to withdraw extremities from the source of the painful stimuli. The next slide will discuss the abnormal flexion and extension. Assessing motor response in an unconscious patient by applying a noxious stimuli and then observe the patient's response to it. Another approach is central stimulation, such as sternal pressure. Central stimulation produces an overall body response and is more reliable than peripheral stimulation for this purpose. The reason? In an unconscious patient, peripheral stimulation, such as nail bed pressure, can elicit a reflex response, which is not a true indicator of motor activity. If you use central stimulation, be careful as not to cause bruising the soft tissue above the sternum. Instead, maybe squeeze the trapezius muscle because it is less traumatic. Supraorbital pressure is another option for central stimulation, but don't use it on patients with suspected facial fractures. A sudden change from baseline in a neurological sign often indicates deterioration. Change in level of consciousness will occur before you see a noticeable change in vital signs. Pupillary responses mirror the status of the midbrain and pons. Pressure further down compromises cranial nerve 9 and 10 and the protective mechanisms such as gag and cough reflex. Decorticate posture is a sign of damage to the nerve pathway between the brain and spinal cord. Decorticate posturing is an interruption in the cortical spinal pathway. An abnormal is a sign that the patient's condition has deteriorated. Decerebrate posturing is an abnormal body posture that involves the arms and the legs being held straight out, the toes being pointed downward, and the head and neck being arched backwards. The muscles are tightened and held rigidly. This type of posturing usually means that there has been severe damage to the brain. The neurological checks. Full consciousness. The patient is alert, attentive, and follows commands. If asleep, they respond promptly to external stimulation, and once awake, remain attentive. Lethargy. The patient is drowsy but awakened, although not fully to stimulation. The patient will answer questions and follow commands, but will do so slowly and inattentively. Obduntation. The patient is difficult to arouse and needs constant stimulation in order to follow a simple command. He may respond verbally with 1 or 2 words, but will drift back to sleep between stimulation. Stupor. The patient arouses to vigorous and continuous stimulation. Typically, a painful stimulus is required. The patient may moan briefly but does not follow commands. Their only response may be an attempt to withdraw from or remove the painful stimulus. Coma. The patient does not respond to continuous or painful stimuli. They do not move except possibly reflexively and do not make any verbal sounds. Looking at the difference between Broca and Wernicke's and how to assess the cerebellum. For Broca, the Broca's area is one of the main areas of the cerebral cortex responsible for producing language. This brain area controls motor functions involved with speech production. Persons with damage to the Broca's area of the brain can understand language, but cannot properly form words or produce speech. Another way to remember it is that if Broca's broke, you know spoke. Wernicke's area is a region of the brain where spoken language is understood. This is receptive. So think of a wide receiver in football. Begins with a W. Wernicke's area is receptive speech. To assess the cerebellum, it cannot be done if the patient is unable to follow commands. If the patient is in bed, you may not be expected to assess balance and gait. In that case, limiting the test to coordination is acceptable. Hold up your finger and have the patient quickly and repeatedly move their finger back and forth from your finger to their nose. Then have alternately touch their nose with their right and left index finger. Finally, have them repeat these tasks with their eyes closed. The movement should be precise and smooth. To assess the lower extremities, have the patient bend their leg and slide the heel along the opposite shin from the knee to the ankle. This movement too should be accurate, smooth, and without tremors. If the patient is able to stand and not restricted to bed, then you can assess balance using the Romberg test. Have them stand with their feet together, arm at their side, and eyes open. They should be able to stand upright with no swaying. If they can do that, have them close their eyes and stand the same way. If they fall or break stance after closing their eyes, the Romberg test is positive, indicating proprioceptive or vestibular dysfunction. The cranial nerves are 12 pairs of nerves that can be seen on the ventral or the bottom surface of the brain. Some of these nerves bring information from the sense organs to the brain, and other cranial nerves control muscles, and other are connected to the glands or internal organs such as the heart and lungs. Assessing olfactory nerve 1. This is done by assessing the patient's ability to smell items that are placed under the nose while the eyes are closed, and is a method used to test for cranial nerve 1, the olfactory nerve. Gather some items with distinctive smells, like cloves, lemon, or coffee. Have the patient smell the items one at a time with each nostril. Record what the item is and the strength of the odor. Optic 2. This again is a type of sensory nerve that transforms information about vision to the brain. To be specific, this supplies information to the retina in the form of ganglion cells. The pupils constrict in response to a bright light or when used for near vision when reading. To test this, have an eye chart or a Snellen chart. Doesn't have to be perfect, but have them read the lines at various distances from the chart. Another thing with cranial nerve 2, you see red, green, or blue. Ocular motor 3. This is a form of motor nerve that supplies to different centers along the midbrain. Its functions include superiorly uplifting eyelid, superiorly rotating eyeball, constriction of the pupil on the exposure to light, and operating several eye muscles. Check the pupillary response, the ocular motor nerve, and look at the diameter of the patient's eyes in dim light and also in bright light. Cranial nerve 4, trochlear nerve. This motor nerve also supplies to the midbrain and performs the function of handling the eye muscles and turning the eye. It's part of 3 nerves that control eye movement and pupil diameter, cranial nerves 3, 4, and 6. Hold up a finger in front of the patient and then move the finger up and down and right and left. Check for differences in the sizes of the right and left pupil. Cranial nerve 5, the trigeminal nerve. This is the largest cranial nerve in all and performs many sensory functions related to nose, eyes, tongue, and teeth. It basically is further divided into 3 branches that are ophthalmic, maxillary, and mandibular nerve. This is a type of mixed nerve that performs sensory and motor functions in the brain. To test the motor part of the nerve, have the patient close their jaw. To test the sensory part of the trigeminal nerve, lightly touch various parts of the face with a piece of cotton or a blunt object. Abducens, cranial nerve 6. This is again a type of motor nerve that supplies to the pons and performs function of turning the eyes laterally. Cranial nerve 7, the facial nerve. This motor nerve is responsible for different types of facial expressions. This also performs some functions of sensory nerve by supplying information about touch on the face and senses of the tongue and the mouth. The motor part of the facial nerve can be tested by asking the patient to smile or frown or make funny faces. The sensory part of the facial nerve is responsible for taste on the front part of the tongue. Vestibulocochlear nerve, cranial nerve 8. This nerve is basically functioning and providing information related to the balance of head and sense of sound or hearing. It carries vestibular as well as cochlear information to the brain and is placed near the inner ear. Although the vestibular cochlear nerve is responsible for hearing and balance, testing hearing can be the fingers rubbed near the ear or determine the distance at which the patient can hear a ticking of a clock or a stopwatch. Glossopharyngeal nerve, cranial nerve 9. This is a sensory nerve that carries sensory information from the pharynx, the initial portion of the throat, and some portion of the tongue and palate. The glossopharyngeal nerve is responsible for taste on the back part of the tongue. Information sent is about temperature, pressure, and other related facts. It also covers some portion of taste buds and salivary glands. The nerve also carries some motor functions such as helping and swallowing food. When the patient drinks, you are observing the swallowing reflex. Vagus nerve. This is a type of mixed nerve that carries both motor and sensory functions. This basically deals with the area of the pharynx, larynx, esophagus, trachea, bronchi, and some portion of the heart and palate. It works by constricting muscles of the above areas. In the sensory part, it contributes to the tasting ability. Cranial nerve 11, spinal accessory nerve. As the name states, this motor nerve supplies information about spinal cord, trapezius, and other surrounding muscles. It also provides muscle movement of the shoulders and surrounding neck. Cranial nerve 11, the spinal accessory nerve, is tested by asking the patient to shrug their shoulders and turn their head against resistance. You would apply only light pressure when the head is moved. Cranial nerve 12, hypoglossal. This is a typical motor nerve that deals with the muscles of the tongue. Cranial nerve 12, the hypoglossal nerve, is tested by asking the patient to stick out the tongue and move it from side to side. Cranial nerve 12 is talking about the tongue. A dermatome is an area of skin that is mainly supplied by a single spinal nerve. Dermatomes are useful in neurology for finding the site of damage to the spine. Because painful dermatomes are symptoms, not causes, of an underlying problem, surgery should never be determined by pain. Aching in a dermatomic area indicates a lack of oxygen to the nerve has occurred and inflammation somewhere along the path of the nerve has happened. A compressed spinal nerve, for example, will show as a loss of motor function, like a loss of muscle mass in an area, or it has an inability to use the muscle against gravity elsewhere on the body, but may or may not exhibit symptoms in the dermatic area covered by the compressed nerve. There are 8 cervical nerves, 12 thoracic nerves, 5 lumbar nerves, and 5 sacral. Each of these nerves relay sensation, including pain, from a particular region of skin to the brain. Along the thorax and abdomen, the dermatomes are like a stack of discs forming a human, each supplied by a different spinal nerve. Along the arms and the leg, the pattern is different. The dermatomes run longitudinally along the limbs. Although the general pattern is similar in all people, the precise areas of innervation are as unique to an individual as fingerprints. Viruses that affect spinal nerves, such as herpes zoster infections, like shingles, can reveal their origin by showing up as a painful dermatomic area. Herpes zoster is a virus that is dormant in the dorsal root ganglia, migrates along the spinal nerve to affect only the area of the skin served by that nerve. Symptoms are usually unilateral, but in the immune suppressed, they are more likely to become bilateral and symmetrical, meaning that the virus is present in both ganglia of a dorsal root ganglion pair. Definitions: atonia, loss of muscle tone. Cognitive. Cognitive abilities refer to mental abilities with regard to orientation to time, place, person, and ability to recall recent and past events. Corneal reflex. When the cornea is touched purposely or accidentally, the eyelids blink and tears are secreted. This is a normal response and is called the corneal reflex. Hyperventilation produces cerebral vasoconstriction and alkalosis, which increases the likelihood of seizure activity. Iodine allergy. Allergies to iodine and or shellfish need to be explored because the patient may have a similar reaction to a dye used in a procedure. In many cases, they may be pre-medicated with antihistamines or steroids before a test. If contrast medium is used, IV fluids may be used to promote excretion of the contrast medium. Peripheral neuropathy. Long-standing diabetes mellitus causes peripheral neuropathy. Hypoactive responses or no response to stimulation of deep tendon reflexes is one symptom of diabetes-induced peripheral neuropathy. SNS. Stimulation of the sympathetic nervous system initiates the fight or flight response, increasing both the heart rate and force of contraction. Strength assessment. Observe to see whether strength and movement are bilateral equally and strong. Always compare one side to the other side when an extremity is being assessed or two sides exist. Anomia is the inability to name objects or to recognize written or spoken names of objects. Apraxia. Impaired planning, sequencing of movement that is not due to weakness, coordination, or sensory loss. Although movements cannot be performed for a specific situation, they may be performed under other circumstances, like inability to lift feet off the floor when attempting to walk, but preserved ability to perform bicycling movements of the legs while lying in bed. Results from disassociation of parts of the cerebrum is often associated with parietal lobe lesions. Agnosia. Loss of ability to recognize even with intact sensations and memory. If it's caused by a lesion, it's usually bilateral. Aphasia. Aphasia causes difficulty in speaking, listening, reading, and writing, but does not affect intelligence. Individuals with aphasia may also have other problems, such as dysarthria, apraxia, or swallowing issues. Amnesia is a partial or total loss of memory. Anosmia. This is an inability to perceive odor or a lack of functioning olfaction resulting in the loss of the sense of smell. May be temporary, but traumatic anosmia may be permanent. It can be due to inflammation of the nasal mucosa, allergies, nasal polyps, and traumas. Asterixis is sudden palmar flapping movement of the hands at the wrist. It is indicative of metabolic encephalopathy, also called the flapping tremor or liver flap. It is a tremor of the hands when the wrist is extended, sometimes said to resemble a bird flapping its wings. Neurons have the amazing ability to gather and transmit electrical chemical signals. Think of them like gates and wires in a computer. There are three classes of neurons. Sensory neurons carry information from the sense organs, such as the eyes and ears, to the brain. Motor neurons control voluntary muscle activity, such as speaking, and carry messages from nerve cells in the brain to the muscles. All the other neurons are called interneurons. Glial cells, the major distinction is that glia do not participate directly in synaptic interactions and electrical signaling, although their supportive functions help define synaptic contents and maintain the signaling abilities of neurons. The cerebrum is concerned with higher brain functions, interpreting sensory impulses and initiating muscle movements. It stores information and uses it to process reasoning. It also functions in determining intelligence and personality. The brainstem is the region of the brain that connects the cerebrum with the spinal cord. It consists of the midbrain, medulla oblongata, and the pons. Motor and sensory neurons travel through the brainstem, allowing for the relay of signals between the brain and the spinal cord. The brainstem coordinates motor control signals sent from the brain to the body. The brainstem also controls life-supporting autonomic functions of the peripheral nervous system. The cerebellum is the area of the hindbrain that controls motor movement, coordination, balance, equilibrium, and muscle tone. Like the cerebral cortex, the cerebellum is comprised of white matter and a thin outer layer of densely folded gray matter. The folded outer layer of the cerebellum, the cerebellar cortex, has smaller and more compact folds than those of the cerebral cortex. The cerebellum contains hundreds of millions of neurons for processing data. It relays information between body muscles and areas of the cerebral cortex that are involved in motor control. The ability to follow the instructions, walk heel to toe, on toes, then on the heels, provides information about the cerebellum. Cerebral spinal fluid. Normal CSF is clear and colorless, and collection is to test to look at the fluid that surrounds the brain and spinal cord. CSF acts as a cushion protecting the brain and spine from injury. The fluid is normally clear and is also used to measure pressure in the spinal fluid. Lobes of the brain. The frontal lobe is reasoning and problem solving are functions of the anterior frontal lobe. The frontal lobe is responsible for many functions, including judgment, reasoning, voluntary eye movement, and motor function. Damage to the frontal lobe can lead to changes in sexual habit, socialization, and attention as well as increased risk-taking. Occipital lobe, located at the back portion of the brain, is associated with interpreting visual stimuli and information. The primary visual cortex, which receives and interprets information from the retinas of the eyes, is located in the occipital lobe. Damage to this lobe can cause visual problems such as difficulty recognizing objects and inability to identify colors and trouble recognizing words. Parietal lobe is located in the middle section of the brain and is associated with processing tactile sensory information such as pressure, touch, and pain. A portion of the brain known as the somatosensory cortex is located in this lobe and is essential to the processing of the body's senses. Damage to the parietal lobe can result in problems with verbal memory and impaired ability to control eye gaze and problems with language. Temporal, located on the bottom section of the brain. This lobe is also the location of the primary auditory cortex, which is important for interpreting sounds and the language we hear. The hippocampus is also located in the temporal lobe, which is why this portion of the brain is also heavily associated with formation of memories. Damage to the temporal lobe can lead to problems with memory, speech, perception, and language skills. The posterior temporal lobe integrates the visual and auditory input for language comprehension. The temporal lobe contains the auditory center for sound interpretation. The peripheral nerves are the ones outside the brain and spinal cord. Like static on a telephone line, peripheral nerve disorders distort or interrupt the messages between the brain and the rest of the body. There are two types of cells in the peripheral nervous system, and these cells carry information to sensory nervous cells and from motor nervous cells of the central nervous system. Postcentral gyrus, sensations on the left side of the body, is located in the right postcentral gyrus, the primary sensory area of the brain. It allows stereognosis, which is to recognize, form, and touch objects. Collective stimulation of this area reinforces recognition by both hemispheres of the respective anatomical contacts being held at that time. Precentral gyrus, also known as the motor strip or primary motor cortex, is part of the brain's neocortex responsible for executing voluntary movement. Compare the functions of the two divisions of the autonomic nervous system. We have the sympathetic nervous system is involved in the stimulation of activities that prepare the body for action, such as increasing the heart rate, increasing the release of sugar from the liver into the blood, and other generally considered as fight or flight responses that serve to fight off or retreat from danger. Parasympathetic nervous system activates tranquil functions, such as stimulating the secretion of saliva or digestive enzymes into the stomach. Looking how this relates to older adults, the older adult would experience certain neurological changes associated with aging, like hypoactive deep tendon reflexes. Loss of vibration sense can impair balance and coordination, predisposing a patient to falls. A Babinski in patients older than 2 is considered abnormal and would be indicative of central nervous system disease.